Welcome back to the podcast. Today, we've gathered your top questions about Medicare coverage, costs, and planning, and we're answering them all in one place. Let's jump in. Question 1. Do I qualify for Medicare when I move to Australia? This is a big one, and the answer depends on your visa. If you're moving to Australia as a permanent resident, yes, you could be eligible for Medicare. You can register once your residency is approved, but most Americans move under temporary visas, like work or student visas, and here's the catch. The U.S. is not part of Australia's healthcare agreements, so unless you're a permanent resident, you won't qualify for Medicare right away. Question 2. How does private health insurance work in Australia? Private insurance in Australia works alongside the public system. It helps cover services that Medicare doesn't. Things like dental, vision, ambulance services, and access to private hospitals and specialists. Plans are generally more affordable and transparent than in America, and many offer family bundles that include extras like orthodontics and mental health support. Question 3. What if my child needs to see a doctor after we arrive? Great question, and a real concern for most parents. If you've already set up private insurance, you can typically book a general practitioner or a GP visit within a few days. Some clinics may even offer same-day appointments. For pediatric specialists, you will need a referral, but with private insurance, wait times are shorter and you'll have more control over your provider. Our advice, as soon as you settle in, register with a local GP. That way, if something comes up, even a fever or cough, you won't be scrambling. Question 4. Will my prescriptions be covered in Australia? Many common medications are available in Australia under the Pharmaceutical Benefits Scheme, or the PBS, which keeps price low. A prescription might cost $100 in America and only cost $30 to $40 in Australia. We recommend bringing a supply of your medication and a copy of your prescription list for reference, especially for chronic conditions. Question 5. Do I need to worry about ambulance coverage? Yes, and this surprises many. Unlike in America, ambulance services are not usually covered in Australia. In some states, Medicare offers partial coverage, and in others it doesn't. One emergency ride could cost hundreds of dollars out of pocket. The good news? Most medical health plans include ambulance coverage, so it's another reason to get insured before you move. Question 6. What's one thing families forget when planning for healthcare? Immunization records, hands down. If you're enrolling children in an Australian school, you need proof of vaccinations, and it has to align with the Australian schedule. Your American documents are valid, but they have to be translated into the local system. At SDC International Shipping, we believe no family should arrive in a new country with questions like, how do I get Medicare? Or, can my child see a doctor this week? We guide American families through successful, stress-free relocations. Do you need help with your move from America to Australia? Give us a call or visit our website. From packing and freight to helping you prepare your life abroad, SDC is your relocation partner, start to finish.